This is Dr. Shakil Ahmed. Today, on behalf of Shakil Health Society YouTube channel, I want to present the ultrasound artifacts. The ultrasound artifacts are divided into four categories. The first category is the acoustic artifacts. In these are related to the way in which the ultrasound beam interact with the patient tissue. The second category is equipment setting artifacts. These artifacts are due to inappropriate control setting at the time of acquisition. The third category is Doppler artifacts, various appearance relating to the way in which the Doppler information is acquired and displayed. And the fourth category is electronic noise and electrical interference effect. These artifacts are inherent to electrical equipments. These are also divided into four categories. First of all, the most popular are attenuation artifacts. In these are resulting from variation in attenuation in different tissue. Attenuation artifacts are such as posterior enhancement, posterior shadowing, or edge shadow effect. The second category in acoustic artifacts are depth of origin artifacts, causing echoes to be displayed at incorrect depth from the transducer. Third, beam dimensions effect, resulting from the finite dimensions of ultrasound beam. Beam path artifact, resulting from the deviation of the beam from its intended and assumed path. Attenuating artifacts. Attenuating artifacts are the following: acoustic enhancement artifact, acoustic shadowing artifact, and edge shadowing artifact. The first two types, acoustic enhancement artifact and acoustic shadowing artifact, is already discussed in one of my previous uploaded videos. So I will only explain the edge shadowing artifact in this clip. Edge shadowing is a reflective or refractive effect seen deep to the margins of the rounded structures that have a speed of sound different from the surrounding tissue. These artifacts are frequently seen arising from the cystic structures, appearing as a very narrow shadow in line with the beam direction. These images show the edge effect artifact. In this image, this is the gallbladder. In these two thin hypoechoic lines are called edge effect. In this image, it is shown that the cystic structure is here and the edge effects are lying in its edges. This is the gallbladder, and on one side we can appreciate the edge effect. This is another cystic organ and the beam is coming, and there are two edge effects. This is the transducer. The beam is coming, hitting the cystic organ. Some waves are reflected and some waves are refracted. So the waves are going on this side, while this side is sphered, and therefore the edge effect shadowing is caused. Edge shadow artifact may also be seen arising from the edge of the right kidney, which has a different speed of sound from the adjacent liver tissue. Edge shadows may not be apparent when using multiple focal zones and when the focal zones is set some distance from the depth of the rounded structures. Thank you very much for watching this video. I hope it will be helpful, especially for the beginners. If liked, please subscribe the channel. Thank you.